I'd like to thank Future Pathways for giving me the opportunity to speak on their platform. And thanks to Khalid for his great arrangement for this session. So starting with the session, first of all, I don't have any conflict of interest. And the objective of this session is mainly to understand the importance of documenting the case report in medical practice, and also to be able to write your own case report and publish it. So basically at the end of this session, I promise you that you would be able to write a case report and publish it. And I'm telling you that because I already did this session maybe in April. And some people later on, they sent me emails with their submission and with their initial acceptance. So this is a subjective tool that can prove that this works. And I'm going to take my time. I've been told before that I speak a little bit fast, so I'm going to take my time to speak slowly and emphasize important information. So first of all, what is case report? So case report is a powerful tool to disseminate information. So writing case report about what? About unusual clinical presentation, disease association, unusual side effect of treatment or response to treatment. For example, atopic dermatitis or eczema is a very common disease, but then we noticed that patients with atopic dermatitis could get vitamin D deficiency. So this is an important association for a common disease. Why? Because when you publish such a case report, maybe other physicians would screen their children for vitamin D deficiency by history, physical examination, or do labs. Unusual side effects of therapy, that most of the commonly used medication, they tend to have side effects that we don't know about because they're like in phase 4. So they're in the market. So when you see any unusual side effect, just report it. And lastly is response to treatment. So let's say that you have a patient where you tried the what the book says in terms of treatment, but did not work. So he tried something else based on the pathogenesis of the disease and it worked, and you want to share your result. Why this is important? Well, this is important because maybe later on they will take your case report and do a clinical trial on the same treatment. So you're helping the literature. And this is here very important that most of the important clinical trials actually were inspired from small observation or case report. So do not underestimate case reports. So Sir William Osler said that please always note and record the unusual, publish it, place it on permanent record as a short, concise note. Such communications are always of value. And he's absolutely right, because usually we start most of our trials based on small observation that we've seen in the case report. So as you can see here, I'm showing you the pyramid of evidence. And we know that on the top of the pyramid of evidence that we rely on is meta-analysis, systematic review and meta-analysis. But on the bottom of the pyramid is, like observation by expert, and the case report, case series tend to be on the bottom of the pyramid. But I intentionally decided to choose this diagram because if you see on the left side, there is an arrow. So basically you cannot go to the top of the pyramid without, just climbing the pyramid, which means that you need a base of a case report or something to start your clinical trial. So in this presentation, I'm gonna show you 5 simple steps to summarize how to write your own case report and how to publish it. So the first step is recognize, then search, then collect, write, and finally submit. So we're gonna take each step and then go through it in details. Starting with the first one. So what is recognition? So recognition is identification of someone or something from previous encounter or knowledge, which means that I'm a medical student. I did not work in radiology. I didn't work in dermatology. I didn't work in ENT. How come I'm gonna know what to choose to write on, what to choose to publish? So basically here you need a help from, for example, a staff, consultant, senior, for example, because even if you're doing 1 month of, like, let's say elective in the specialty that you want, for example, obstetric and gynecology, what is the chance that you might see a very rare case during that month? It's a bit lower than the chance of a staff who's working there for years that probably saw many unusual things or many rare cases. So Here you need a help of a staff or a senior resident to guide you to what to write on. I think this is very important, and the support is very important from the staff or senior resident. So I always get this question, what to choose to write on. So basically you could choose to write on a very rare disease. For example, most of the time it's a genetic disorder. You could choose to write an unusual presentation of common disease. What do you mean by that? Well, I mean that the disease is usually presenting, like, let's say one tumor, you have a type of tumor that always present on the face. But you have a patient who presented with the same tumor, but on the leg. And you looked in the literature and all of the cases were published on the face. So this is a rare, unusual presentation of something we usually see. The other thing is, well, let's say, for example, lung cancer. So you have a patient, we know that usually smokers, elderly. So let's say that's someone who's young, like 10 years old, never smoked and developed lung cancer. So that's unusual presentation of maybe something common, the association we mentioned, but also it's, like let's say psoriasis, for example, is a chronic skin disease, but then they got some joint inflammation called psoriatic arthritis. So that's an association of a common disease. Positive response to treatment, as we mentioned, that you gave a treatment that wasn't given before maybe, or was tried before, and you saw a positive response. So you want to share it with your colleagues, so maybe they can also try it. And then people write about it, and then maybe they do a clinical trial on it to be approved by FDA and recognized as a treatment option for those patients. Unusual side effect of medication, and we mentioned that usually when we have a new medication, it's in phase 4 trial, so basically it's out in the market, and we don't know about all the side effects profile. So maybe some patients, they develop unusual side effects that will make us withdraw the medication from the market. Okay, let's see some examples. So sorry, all my examples are in dermatology because it's my field, but anyway, just bear with me because you could correlate whatever your specialty is. So this is a disease called porokeratotic eccrine disease. Basically, patients were born with this nevus on, it's a very thick skin on top of their skin. And the treatment in the book says just give some type of cream that will remove this thick skin. I'm trying to be so simple here. But we tried with this patient using a CO2 laser. And CO2 laser tend to remove this thick skin. So we reported this case. So here we are reporting the good response to a medication or a treatment option that wasn't tried before. So that's good. The other thing is a disease called Hailey-Hailey. It's a familial disease where they get erosions and blisters and inguinal folds. And the treatment option is basically, if you read the box, it will say, for example, put topical corticosteroid cream. But with this patient, we tried using naltrexone and magnesium, and that wasn't published before. And we saw a very good response. But we tried that after our patient failed the regular treatment that present in the book. And now, maybe more people will write about this treatment option. So then later on, they can do a clinical trial. This patient, she was a young patient, and we know keloid is very common. And we see keloid most of the time in patients with darker skin color. It's a type of thick scar. But this patient, she is young, and then she developed keloids all over her body. So that's an unusual presentation of something common, This patient here has on the right lower side, I don't know if you can see my arrow, she had a microcystic adenic cell carcinoma. So that cancer usually comes on the face, but she had it on a non-sun exposed site, and she had it on the inner thigh. So we reported that case as unusual presentation. Again, another case of unusual presentation with this lady who developed a unilateral sixth nerve palsy after developing herpes zoster ophthalmicus. And that's not very common. I think there is only one published case in peds. And then you could publish on something extremely rare, like this case of congenital sideroblastic anemia with B-cell immunodeficiency, periodic fever, and developmental delay. I am pretty much convinced that I might not see this case in my life again, because there are like only 60 clusters of families reported with this case, so it's extremely rare. And they tend to have skin manifestations. So let's say that with the help of a staff or a senior residents, and you rotated it at your field of interest, and you found a case that you really think it's publishable and very good. So what is the next step? What should I do next? So the next step would be running a literature review. And for time's sake, it's hard here to go over how to do literature review search, but I'm gonna tell you a very simple, easy way to do it that is at least will help you with doing case report. All what do you need for case report, okay? So we're gonna use Medline or PubMed. And if you go to PubMed website, on the right lower, this is the main page of PubMed. On the right lower part, you would see mesh database. A mesh database, basically, they give you the definition of the word that you're looking for with all the possible synonyms in the literature. So for example, here I tried in this example, hand washing. So it tells me that hand washing can be also called disinfection, hand sanitization, surgical scrubbing. So basically you have to take all these mesh words, the synonyms for the hand washing. And I was also looking for MRSA. So it can be MRSA of the whole thing or just the abbreviation. And then you go back to the main page and click on advanced. And in advanced search, basically you put the words that you use for the first word, for example, hand washing. And then here on the left side, just make sure that you put or. So hand washing or hand washings with S, for example, or hand sanitization and then you put also the other word and or all the synonyms for the other word. I put for you here a video on YouTube that gives a very nice, easy tutorial on how to do a literature search for PubMed. But for case reports, you don't really to go crazy on literature research. That's more important for systematic review that you really need to do it very properly. Okay, so basically you did your search and there are two chances. The first one is you didn't find similar cases in the literature. So bravo, your case is has a great chance to be published. So you passed the first step, now move to the next step. The second scenario is, well, I found a lot of cases similar to my case. I don't think it's interesting or publishable. So what should I do? Should I just forget about it and move on? Well, still there could be a chance. What you can do is you could find something interesting in your case. And I mean by that is look at details in the other cases. See what was the age that the other cases presented. Let's say, for example, you found disease A and all the other cases in the literature that you found were presented over the age of 60. And your case was presented in, let's say, 12 years old boy. So basically, well, this is a good thing. So you could say, well, my case is childhood presentation of this disease. So you're making it interesting. The other thing that you notice in the literature, all the cases were published in men and your case is a woman. So basically you could say, well, I'm presenting the first case of this disease in a female, for example. Well, most of the cases were published in, like, let's say, the face, but usually it's bilateral on both sides of the face or on the legs, and it's most of the time bilaterals, but then this case was unilateral on one side or more localized. So this is another way. You could say, well, my case is generalized, the other cases were localized. You know what I mean? Like, try to play a detective here and find something interesting in your case, and take that interesting point and just write more about it and make it more, stand out in your paper. So basically you read the topic and then you found similar reports, and you should download everything you found in a document. That's what I use most of the time, in a PDF file. And then because I'm going to use them later in the discussion part. Okay. So the third step is, after doing the literature review and having your own case, basically you need to take an informed consent from the patient, collect the proper history and physical examination. If there is a histology, pathology, x-rays, important labs, you have to collect them all. For the informed consent, most of the journals that I dealt with, you just have to write in the case report a sentence that, for example, the informed consent was taken from the patient. Or during the online submission, there is an option where you said, I certify that the informed consent was taken from the patient. Some journals, they ask you to download their own informed consent and ask the patient to sign it. I usually recommend, if you're doing an informed consent, always take your own hospital informed consent, and basically you can upload it to the website instead of, because at the beginning you may not know what journal you were submit to, and that will make it difficult, just to download all the informed consents from all the journals and ask the patient to sign them, but you don't know which journal will take your paper. So for example, I took an example of the Saudi Journal of Medicine and Medical Sciences, and they have their own informed consent in Arabic and in English. And you could download it and ask the patient to sign it and submit it if you know for sure that you're going to use their journal. Okay, so now this is the most important step of the case report, and I will take my time in this step because this is what you're going to do. How do I write my case report? if you go to any journal, you will find a section called author's guidelines or author's instructions. They will tell you how they want you to structure their manuscript. The steps I'm giving you here in this presentation is the most common steps used by all journals. What I usually do most of the time is I write my case report using these steps that I'm gonna show you right now. And then basically, if I see something odd in the author's guideline of the journal, then I adjust my paper based on that. Is that clear? Because that's the most important thing. Okay. So we mentioned that most of the journals use this style. First of all, you need Word documents, so you need Microsoft Words to use that. The font, most of the journals, they want you to use Times New Romans. And in terms of font size, I usually use 12. Like 99% of the time I use 12. So you can use 11 or 12. Make sure that all double spaced. And I'm gonna show you now in an example how to do that. Then make sure that you add continuous numberings. And what is continuous numberings? Basically, they're numbers on the side for the reviewers. When they read your paper, they're basically going to refer to a point in the paper. They're going to tell you, well, look to line number 100 or line number 50, for example. Pages numbers, all pages should be numbered, and it depends on the journals. I mean, some of them, they're picky. They want it to be on the right upper corner. Some of them, they want it to be on the right lower corner. Fine. Just do it the way they want. And then running head, and what do I mean by running head? We'll see that in the next example. So this is a screenshot of a Word document. I don't know if you can see my pointer, but so you can see on the upper left side of the page, the Times New Roman, this is the font style, and then next to it, the font size, which is 12. On the top of the page, there is a running head, and basically you just have to double click on that part of the page, and it will allow you to write something. Most of the journals want it to be 50 characters. So 50 characters, basically like 50 words, no more than that. And the running head is basically a summary of the big, long title. From this here, you can add the double spaced, make sure it's number 2. And that means that the spaces between each line is around 2. Here you can see on the left side, the continuous numbering. And I told you continuous numbering is very important for the review step, because the reviewers, when they want to ask you to go back to something you wrote in your paper, they're going to tell you go back to line number 50, go back to line number 60. So from where do I add the the continuous numbering? Basically click on layout in Word document and then click on continuous. The other thing is basically if you want to add the number to the page, click on insert, and then you can see on the right side, page numbers. The first page of your case report, the whole document is called manuscript. The first page of your manuscript is the title page, and you will see all the journals, they're telling you, please add in the title page, please do not add in the title page. So what is the title page? So the title page is the page that has the title and then the names of all the authors. And then basically next to each name, you're gonna add a number. And I see a lot of medical students actually confuse these numbers by is it the number of the authors? So does that mean number 1 is the number 1 author and number 2 author? No, it doesn't mean the order of the authors. The numbers next to the authors actually refers to their institution. For example, for me, he is number 1, so I'm from McGill, so this is a division of dermatology at McGill University. Let's say that I'm also working in another institution back in Saudi Arabia, King Saud bin Abdulaziz University for Health Sciences. I could add to myself number 1 and number 2. And then I could add here number 2, which is King Saud bin Abdulaziz University for Health Sciences. So I could add to myself even 3 numbers, it's fine. So the numbers here refer to your institution. It does not mean your order. We're clear with that because I see a lot of medical students confuse that. The other thing is the corresponding author. And again, I always get this question, what does it mean? I want to be the corresponding author. Why the staff is the corresponding author? The corresponding author means that once your paper is published in the journal or the literature, and let's say the paper that we mentioned earlier that was on naltrexone and on magnesium, and I did not mention the dose, I didn't mention how long I treated my patient, and I'm a dermatologist and I have a patient with a similar condition, and I want to ask you about how much did you give your patient, for how long did you treat your patient? I could send you an email through knowing who is the corresponding author on the paper. So the corresponding author on the paper is who to contact when the paper is already published in the literature for getting further information. I hope that's clear, because some students, they tell me, why the stuff doesn't make me the corresponding author? I want to be the corresponding author. That doesn't mean anything. It just means who knows the case better to answer the questions. And then after that, you will add the words count, figures, tables, references, keywords. Most of the journals, they will ask you to add up to 6 maximum keywords. And do you remember when we started looking at the PubMed website and I showed you how to look for the terms and how to search the literatures? Well, guess what? The keywords will make your work be searchable using these keywords. For example, this study that I published, I put, for example, hidradenitis suppurativa, acne inversa, keloid scars. So whoever is going to use PubMed or Medline and gonna write keloids will see my paper. Whoever is gonna use keloid scars will see my paper. Anyone will write hidradenitis suppurativa or acne inversa will see my paper. So basically, what terms should I put here to make my paper very searchable? Add as much as you can, but most of the journals ask you to add up to 6 words. Funding, I mean, you usually write funding when you do the online submission, but you can also add it in the title page, what you use most of the time. And you could say like, well, there's no funding, none. And then basically declaration of conflict of interest. I see most of the journals actually keep this one as the last line of their paper. I used to keep it in the title page, but not anymore. Now I just put it before the references. So we're done with the title page. So what should I do next? So you could do an abstract. For case reports, some journals, they do not ask for abstracts, and some ask you for unstructured abstract. And what does unstructured abstract mean? So unstructured abstract means that you're just gonna write 2-3 lines as a summary of your case. Like let's say during your sign out, the staff or the resident tell you, can you give me 2-liners on this patient summary? So basically this is it. It's just an unstructured paragraph of 2-3 lines maximum on what happened with the case. Now, just for your information, what does it mean, structured abstract? Structured abstract that we use in the original studies means like a background and objectives, the methods, the results, the conclusion. So that's the structured abstract that we don't need in case report because it's very short. So we start with introduction, the case presentation, discussion, conclusion, and finally acknowledgement, and it's optional. And last is references. I'm just gonna take a sip of my coffee. Perfect. So just to give you an example here, I went to the website of the Saud Journal of Medicine and Medical Sciences. And here you click on instructions, but all of the journals, they have this option instructions, and then you can click on authors, instructions, and guidelines. And basically, during that time, you could just look at their instructions and guidelines. And I took a screenshot of their instructions and guidelines on how to format the title page, which is the first page, and then the cover letter of the case report. I'm gonna show you what is the cover letter, but this is the instructions, this is basically what we mentioned. And here, they're just to show you that they have their own informed consent, and basically the abstract is unstructured, and they ask you for 250 words as maximum. I mean, it's different. Some journals, they ask for 200 words, so it varies from one to another journal. The other thing is the limit is 1,000 words. Some journal, they ask you for 400, so 500, so it depends on the journal. And then references up to 15, some they ask for 8, some they ask for 10. So you have to check the author's guidelines to make sure that you address the author guidelines, because when you submit your paper to any journals, first of all, there is a secretary that will go through your paper and make sure that it fits the guidelines. If it doesn't fit the guidelines, she's not even gonna send it to the editor-in-chief. Are you clear with that? Because that's very important. So the introduction is basically the first part of the manuscript. And in the introduction, you're gonna write what is the disease, just identify the disease. So the disease is the definition of the disease, how it's usually present, how it's usually diagnosed, what is the treatment for this condition. And then basically you have to write at the end of your introduction an introductory to your case report. Like, for example, herein we present a case of, or here we report a case of, and then basically introduce your case before the second section, which is the case presentation. I'm gonna give you a tip here. So basically, let's say that you're presenting an unusual presentation of a disease, okay? So basically, you're gonna start by defining the disease, how it's usually present. Focus more in the introduction on how the disease is usually present, because you're writing about unusual presentation, so you wanna focus more on that part of the disease. Let's say that your case presentation is about a new treatment. So basically focus more on the treatment of the disease. So let's say, for example, you introduce the disease, how they present, how they diagnose it, and then basically how they treat it. And then talk more in the treatment section. And after that, say, like, for example, here we used another kind of treatment. I hope this is clear. And then you start with the case presentation. So in the case presentation, it's exactly how we do it in our hospital. It's basically, you start with patients' demographics, their past medical history, surgical history, labs, pathology, if applicable. And then basically you could do important negatives. For example, you know that this disease is usually triggered by trauma or triggered by using certain medication. So write in your history that important negative factor. Say, my patient had no history of previous trauma. My patient did not use this medication. So you have to write the important negative factors. Look, see what caused the disease. And then if that did not cause the disease in your case, just deny them by saying my patient did not use this. Of course, after clarifying with the patient. It should be in a chronological order, and also it should be written in past tense. Okay, now we're moving to the part after the case presentation is discussion. So what is the difference between introduction and discussion? So introduction, I'm talking about the disease, introduce it to the authors, and then given a small line introduction of my case, and then write my case presentation. And then in the discussion, you should compare and contrast the cases published in the literature. And that goes to the first part of our search. When we downloaded the cases that I told you about, now you're gonna use them. For example, you're gonna say, well, Abdulhadi, for example, reported the same case of Haley and used naltrexone and magnesium with a dose of, let's say, 100. Here, I use the same thing, but with a dose of 50. He reported that his case present on the face, my case presented on the legs. He said that his patient was that and my patient is that. So compare and contrast the cases published in the literature and your case. This is very important, and this is what the discussion is about, with, of course, giving citation and references. So you're done with the discussion. So you should write 2 or 3 small paragraphs on conclusion. Even 2 paragraphs, I think, are enough. So the conclusions should be a summary of the whole case. And then you should give a meaningful message to the authors, which means that what is the point of publishing your case? What did it show me? What did I learn from reading your case? So you should tell me that, for example, I put few lines here, common examples for what we usually write at the end of the discussion, the conclusion. Physicians should be aware of this unusual presentation of this common disease. Physicians should be aware of the side effect of the treatment. Physicians should be aware of the association of this, for example, this association with this disease. For example, physicians should know about the association of vitamin D deficiency in patients who lose their hair with alopecia, for example. Why? Because basically they should screen their patients for vitamin D level and supplement them if needed, And then you should list opportunity for future research. For example, for example, the case that we published, the magnesium treatment and the naltrexone, that's a good option, good treatment. So you should tell the authors, well, we still cannot draw a conclusion on this treatment option because I tried it on only 1 case in my case, but we need more cases. We need a randomized controlled trials to know if actually the treatment is effective in treating this condition. So first of all, you give a recommendation to the authors by recommending them doing certain things like screen, be aware, look for, and then you're giving a chance and opportunity for other people to write case, to do like further studies on the case that you reported. References. So I see some students type their own references, which is a lot of job, honestly. It's a lot of work. So basically what I usually do is I use EndNote. And if you haven't done EndNote before, I highly recommend using it because it's very helpful and very practical. So most of the hospitals librarian, they do courses on how to use EndNotes, and there are a few courses online. So most of the journals, I noticed that they use the Vancouver style in writing their references, which is basically author names, title, the journal, the year, the volume, issue, and page to page. Now, check the author's guidelines because some of them use different styles, but the majority they're using Vancouver style. And I think using EndNote is very, very practical and helpful. Now, some journals, they ask you to write a cover letter, some they don't, it's fine, it's optional, but the cover letter is basically a letter to the editor-in-chief in the journal. And the editor-in-chief, like, how come I would know the editor-in-chief by, how do I know? So basically you click on the journal and then click on editorial board. And in the editorial board section, you will see who is the editor-in-chief. And basically you write a letter exactly in the format I'm putting here, saying that we are reporting this case report that has this important value to your readers. And in this letter also, it's very important that you certify that this wasn't published or submitted for publication before. And also you should say that all the authors with me in the paper agreeing with the paper being submitted to your journals, there is no conflict of interest, there is no funding for this, you could add that line as well. I tend to use references in the cover letter when applicable. I find it gives more value when I cite things and say, for example, well, in your journal or in another journal, this treatment was used before and here we used it and we think it's very important to your readers. So I know that English language is not our first language, at least most of us who are watching me back from Saudi Arabia. And also for me, so there is always another way to improve the language of your publication. And that's by, using certain website. For example, this website here, a bit expensive, honestly, but there is also Upwork, and usually you can hire a freelancer from Upwork and then ask them to do like English editing. Just be careful because sometimes the way that we write scientific publication is not the way that articles is written in the magazines or in the internet in general. Yes, it sounds good English, but it's not the right way to write scientific papers. So you should hire someone who's really aware of scientific publication. And usually remember the ABC of writing: accuracy, brevity, and clarity. Make it very accurate, brief, and very clear to the readers. The step after is basically to submit your paper to a journal. So again, what journal should I use? So basically the submission is usually online, and use high impact factor journal. So what does high impact mean? So every journal has their own impact factor. And the impact factor means that the papers that published in that journal, how many times they're being cited before by others. So the more that their papers are cited by others, the higher impact factor they have. The higher impact factor the journal is, sometimes it's more difficult to get your paper published in that journal because it has a very high impact factor. Like look at the impact factor of JAMA, for example, it's very high. And Lancet, Nature, these big journals, they have a very high impact factor because the publications that they published in their paper being cited by many other people from other journals. So that's very important. So go for the high impact first, and then if they reject it, because usually they respond to you very fast, and then move to the second, lower impact factor. So you submitted your journal, your publication to the journal, and they sent it back to you, for example, with major revision. So they asked you to do a major revision in the paper or minor revision. And that's most commonly, like, it's extremely hard that they will accept it from the beginning. They will always say major revision needed for the paper. And the major revision, that's the most common scenario. And you have to respond to the journal, and the way you respond to them. So usually the journal take your paper, send it to 2 reviewers or 3 reviewers, and each one of them read your paper, and then basically they give you comments. So take the comments and basically address them in a separate Word document. Write 2-3 lines saying, thank you for reviewing my paper. I appreciate your comments, your suggestions, and here I'm addressing all of them. Write the first comment, first suggestion, and your response to it, and say where it is in the new manuscript. Because if you change in the new paper, you remember the continuous numbering on the left side of the paper, that will change. So what was 100 before in the initial submission, maybe now it's 120. So not to confuse the reviewers, say now it's in the revised manuscript is 120, for example. Some journals, they ask you to highlight in the same document without writing a separate response to the reviewer document. So you could also do that. So it depends on the journals. You have to check their in authors guidelines, the way that they want you to respond to the reviewers, but most of them, most of the times they want you to write this separate Word document addressing every single comment. So finally, I'm going to discuss a bit of how usually when we do a systematic review, we use original studies, but sometimes because the disease is so rare or there is no much publications on that disease, we use the risk of bias assessment. We need a methodological tool to use for case report and case series. And here I find this one is useful. It's around 8 questions. So why you're telling me this? I'm telling you this is for the future, because if someone will use your case report, for example, to include it in their systematic review, they need to evaluate your paper. And the way that they will evaluate your paper could be using this methodology tool, which basically 8 questions. For example, I did a recent systematic review and I had to use case report and case series. And I just formulated this table where I put all the study on the left side and basically their study design. And I put Q1, which stands for question number 1 up to 8. And then basically I gave yes or no. And then the way you rate it, it depends on you. For me was answering, for example, more than 50% is considered as a valid case report, and I included it in my systematic review. But if it's not answering more than 50%, I'm not including it in my case, in my systematic review. So take home message is basically your first case report will take really time. And I remember my first one took over 2 weeks, and I now am able to write case report in 2 days. So it's fine. It takes really long time, the first one, and it takes effort, but take it as a learning experience because you're gonna learn. Do not give up, because usually high impact factor journals, they tend to reject easily. Sometimes your work is excellent, but it doesn't fit their theme. They don't have space for it. It's not the right time, so they reject it. And I remember big publications were rejected more than 7 or 8 times. Like I read about very important research that actually had a very excellent impact in our clinical practice that was rejected over 17 times. It happens, okay? So just keep working, rework it, improve it until it gets accepted. So I just want to announce that in the next few weeks, I'm going to do a session on how to critically appraise an article. And I think this is very important. I'm summarizing this in 5 simple steps because sometimes we tend to present articles in our academic half-day journal clubs. Sometimes we see a patient, we want to read about a new treatment and we read an original study, but we don't understand the statistical measures that they use, the odds ratio, the relative risk. We don't understand what is number needed to treat. We have the graphs, for example, the first plot, area under the curve. We don't understand them. So in this session, it's going to be 2 hours that I'm going to go through it in details, simplify these charts and all these statistical measures. To see more examples on how to write case reports, I have few published on ResearchGate. You can click on it, Google my page. And then basically my colleague, he's a dermatology resident from Miami, John Zaid, who I worked with initially in 2015, and we published the case report together. Had his, he actually made a very useful PDF file on how to write a case report that he shared it with me when he knew I'm presenting this session for you guys to read more about it. It's on WeTransfer. I'm not sure if it will last, but you could Google his name and you will see it online. To contact me, I'm always active on Twitter, and through email, I usually respond within 24 hours most of the times. If you have questions about your case report, I will be happy to answer them. And also, if you have any other questions, I'm happy to take them now. So I see a few questions, so I'm going to go over them here in the chat box. So the first one is, can I write case reports on a rare condition? Yes, of course you can. It's not, even if it is not a disease, it's a condition. Okay, you could do that. How long the case report usually will be? So I guess this question is, how long does it take for the case report? So usually for the case report, it depends. I say the first one you do would take really about 2-3 weeks, but maybe after it will get easier with time. It's a task that will get easier with time for sure. I wrote a case report, but didn't publish it. Now it passed 3 years. I mean, it depends on, I don't think there is an expiry date for any case report. If it's something rare, you still can publish it. You can find something interesting in it. I know sometimes we write because we want to apply to a specialty, we don't get in, and then we forget about it. So you still can work on it and publish it, yeah. But you have to update it, see if there is anything published after. We're replying to your comments from the reviewer. Do you send him a letter as well? Yes, I do. Not a letter. I usually send the Word document with saying thank you for taking the time to review my paper, and then put every single comment with a response to the comment. It makes it more organized, honestly. Thank you for the lecture. Can you clarify again what are the database to check if the case report has similarity and to assess how rare it is? Basically, you need to check the literature. And I mean by literature, we have so many databases. So the most common one that we use is PubMed or Medline. So you can go to PubMed website and use the mesh database that I showed you, just to improve your search. But you can just put the name in the search section and just write it down. But just going through the mesh maybe will give you more accurate result, I find. If I want to add tables to compare my case with previously published, excellent. Yeah, Abdullah Sharaf. Yeah, this is a very excellent comment. He was saying that if he wanted to compare his case with other cases in a table, I did that. If you see my case reports, I think I did that. It was in a case report I did on atrophoderma of Pacini and Perini, and basically there were few published cases, so I did that. But sometimes, Abdullah, it can be hard if you have so many cases. You can't fit them in one table. What is considered to be a good impact factor? I mean, it depends on the specialty. I would say like for dermatology is usually anything up above like 3, 4 is a high impact factor, because a lot of journals are like 2, 3. I mean, you know, JAD and JAMA, they're like 7, 8, I guess. Don't quote me on that. I'm not sure about the numbers. But in dermatology, we don't have really strong impact factor journals because they don't publish a lot. But other journals, they even have 50 impact factors. So it depends on your field. May you please mention some of the high impact factor journals? I cannot mention the high impact factor journals because it depends on the specialty. For medicine, it's not like dermatology. For dermatology, it's not like radiology, not like obstetric and gynecology. So what you can do is basically they have, Google it, and it's present in, I think it's in a table in the, Elsevier website. They have a table where they put the 10 top impact factors for each specialty. So you will see that. The other thing is also for the introduction, there is a specific step to write it, like the first. The introduction is basically, you just write an introduction where you define the disease, their symptoms, their treatment, but then you introduce your case. But if you are writing about a symptom or a treatment, just focus more on that in the introduction. Okay, so report of any value. Of course, there are very value in your CV. Someone is asking in my area of interest. Of course, I remember when I applied for dermatology, because we're medical students and we don't have that long-term experience and time to do like big studies. So basically I had 7 case reports when I applied for residency. Actually, I had 6 and 1 cross-sectional, which was an easy survey. Okay, well, someone is asking, they wanna see my email. So I'm putting my email on my Twitter account, and you can email me or text me anytime. I usually respond very fast. Can you okay, so basically most of the questions were based on the email. Can I publish the case report on me? I mean, I don't know, honestly. I don't think it's ethically good that you write on yourself. I don't know. I'm not sure about it. Honestly, I haven't seen that. So David is asking, will this presentation be available for us to consult? Very great presentation. Thank you. Thank you, David. I don't know, honestly, but I'm going to see with Khalid if he can upload the presentation on future pathways. If you guys want to follow them on Twitter, and basically they're going to share the presentation. So Khalid Al-Anizi is asking if there is any limited number of words. Yes, there is. So you have to check the journal's guidelines. Most of them, they ask for 1,000 for the whole paper. Some they ask for 200 for the abstract. So the abstract is like 200, and then from the introduction to conclusion, without counting the abstract, is 1,000. Some 800, some 500. So you have to check with the journal. There is no articles about my topic. From where can I get the info and the reference? So if it is something that wasn't published before, that's excellent. So it's publishable. So basically, to get an articles to discuss it and put a reference, see what is in your paper. I mean, I'm pretty sure anything in it will be published before, not the main concept. So you could do that. Thanks, doctor. It was really helpful. Thank you so much. Does it have to be the first case report about the topic, or is it okay? No, it's fine. I mean, if you have few cases, the one I published that was extremely rare were like 60 patients. And now I saw a patient in the past 2 weeks was a pediatric patient with LEP2 meningeal. I think they get like lipomatosis, like lipids, and it's very rare. They get it in the skin and the brain, and it's like only 16 published cases, extremely rare. So that's something very publishable as well. Can you please put the link for the ResearchGate page again? Okay, I'm sorry. This is the ResearchGate and also for the document. Okay, perfect. So they wanted to see the page where there is guidelines. This is a very excellent Nujud Abdul Latif. Excellent question. I always also get this question, and I'm sorry that I didn't mention it. Do I need an ethical approval for the case report? You don't need ethical approval from the hospital or for the journal to publish your case report. Ethical approval needed if you're, like doing a study like cross-sectional studies, giving questionnaires, looking at the charts of the patients, trying something with the patients, you need ethical approval, but not for case report. Most of the time, you don't need ethical approval for case reports. Is what specialty does JAMA publish? So JAMA, the general one is for medicine, but you have JAMA dermatology, JAMA surgery, JAMA psychiatry. So it depends on what you're looking for. The lecture has been valuably informative. Thank you, Amar. How can I have a rare condition or disease when I'm still a medical student? Exactly. So Ahmed was asking this. So at the beginning of the session, I was mentioning that you need the help of a senior resident or a staff to ask them. The staff that I worked with, he sees a lot of rare cases, so he doesn't have time to publish all of them, I'm pretty sure, because he's busy with his clinical practice. But he has a book where he writes the fine number of the patient with their condition. And then basically, if a medical student is interested in that specialty, he would give them the information. And he gave me that. So I'm really grateful for his support. Excellent question. So what is the maximum number of authors for case report? Honestly, I would say 4 to 5, not more than 5 for sure. For case report, do not put more than 5. It makes it, honestly, looks a bit weird, because when you put an author, it means that he actually contributed to the case report. And some journals, they ask you when to do the online submission to say each author contributed for what. Some of them contributed for the introduction, some for the discussion, some for the case presentation. They want to know in details. Thank you, doctor. Can we get the presentation, please? So I'm going to check with Khalid if he can upload it on the Future Pathways on Twitter. Here, their account, and their hopefully they will have it.
Yes, we will post it on the Telegram channel. That's where we usually post PPT.
Okay, perfect. Thank you so much, Khalid. So thank you for this session. It was very helpful. So I'm publishing about a positive response to a specific treatment. Should I mention all previous treatment that were used and didn't show any response before? Yeah, excellent. So you should do that in your case presentation. You should say that my patient tried this treatment first, for how long, it didn't improve. He tried the next treatment, for how long, didn't work, and so on, until you tried the new medication. And also in introduction, you should write the treatment of the condition, what has been tried before and what not. And if someone tried your treatment before, that also is, you could add that. If nobody tried it and you're the first one who tried the treatment, I suggest in the introduction, you write the mechanism of action of your treatment and correlate it with the pathogenesis of the disease. For example, say the disease affects the sodium channel and your treatment works on the sodium channel. So you could add that in your introduction to make us understand why you decided to use this treatment. Okay, perfect. I don't see any, okay, I'm seeing further questions. How to distribute the work for case reports between the authors. So basically the first author is usually a medical student or someone who wrote the case, spend a lot of time on it. I see in Saudi Arabia, sometimes the staff wants to be they're the first author, which is completely different in other, even in Europe. For Europe, for example, in Spain and France, I can tell because I know about that. The first three authors are the most important authors for the institution. So if you're not in the top three authors, they don't really consider your work for certain institution. But in North America, it's completely different. The concept in North America is the first author is the one who did most of the work. And the last author is the senior author, is the someone who supervised the work. And most of the time it's the staff. But in Saudi Arabia and in Europe, it's completely different. The staff always wants to be in the top three. Are two authors enough? Yeah, for case report, two authors are enough. I mean, a lot of case reports are published by two authors. I find one a bit, unusual, and also more than 5 unusual as well. So basically it ranges from 2 to 5. 3, 4 are okay. I mean, 5 we're stretching it, but not more than 5 for sure. Okay. Is it fair to distribute the work as following: 2 authors collect the information and literature review and 1 for writing only? I mean, I would say like 1 would do the literature review and maybe get the cases, and 1 would do like table if needed and write the discussion, because the one who will do the literature review could actually contribute in writing the discussion, and 1 can write the case presentation. I don't find 1 write the whole thing is, but we do it because case report is not a big deal. And writing it alone is not also a big job, honestly. Like a lot of medical students, they could write their own case report on their own, and they put the staff just for their support who will supervise the work. And they put the name of the histopathology, who did, or pathologist if needed. I don't see any, okay, I'm seeing other questions. What did Khalid say about the presentation? I couldn't hear. So Khalid was saying the presentation will be uploaded on the Future Pathways page, if I understood correctly.
Yeah, the Telegram page. So we'll be posting, that's where we post the PowerPoints and any other files that the lecturers share with us.
Yeah, I'm gonna email you the presentation now, and this is the most up-to-date version. And please share it with them. And also, if you guys have any questions, you have my contact information. I told you I usually respond very fast despite being busy with residency. I usually respond like within 1 to 2 days, and I could help you answering any questions. Also, I would be very happy if you share your work with me and show me that you wrote your own case reports and publish it as well. Again, thank you so much for Khalid for organizing this excellent session, and for Future Pathways for giving me the opportunity to speak on their platform.
Thank you so much for presenting this lecture. We really needed it, and as medical students, and we hope that a lot of people benefit from your work. Thank you so much.
Thank you. Have a good day. Bye.